This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending in neurosurgery.
And I'm Dr. Alara, a research fellow. Today we're looking at a fascinating new study from the journal World Neurosurgery, published in 2026. It's a systematic review and meta-analysis titled Minimally Invasive versus Traditional Repair of Spinal Cerebrospinal Fluid Leaks.
This is a timely topic, Alara. We know that spontaneous spinal CSF leaks are a major cause of spontaneous intracranial hypotension, or SIH. For years, the traditional open approach was the gold standard when conservative management or blood patches failed. But the shift toward minimally invasive surgical, or MIS, approaches has been gaining momentum. The goal, of course, is to reduce perioperative morbidity while preserving repair durability. However, until this paper, their comparative effectiveness remained what the authors call incompletely defined.
Exactly. To bridge that gap, the authors performed a systematic review and meta-analysis of contemporary surgical series following the PRISMA 2020 guidelines. They identified 20 studies that met the criteria for qualitative synthesis, and 9 of those contributed to the quantitative meta-analysis.
That's a solid pool for a meta-analysis in this specific niche. Let's get straight to the numbers. What did they find regarding the primary success rate for the MIS approach?
The primary closure success for MIS was impressive, coming in at 95%, with a 95% confidence interval between 88.8% and 97.8%. If we look at the secondary success rate, meaning success after potential reintervention, it climbed even higher to 97%.
Those are excellent numbers for any spinal intervention. But the real question for those of us in the OR is how that stacks up against the traditional open repair. Did the MIS approach sacrifice efficacy for the sake of smaller incisions?
That's the most critical finding, Dr. Aris. When they compared the two cohorts, the success rate for traditional open repair was 94.6%. Statistically, there was no significant difference between the two groups, with a p-value of 0.87, so the repair durability you mentioned earlier seems to be preserved regardless of the approach.
That's a vital piece of data for counseling patients. We can tell them that a minimally invasive approach is just as likely to fix the leak as the traditional open surgery. Now, let's talk about what the patient pays for the surgery, the morbidity. What was the complication profile for the MIS group?
The overall morbidity for the MIS approach was 10.7%. While that's not negligible, it's consistent with complex spinal work. But where the MIS approach really distanced itself from the traditional method was in the hospital stay.
Let's dive into that. Length of stay is a major metric for both patient recovery and hospital resource management.
It was a significant difference. The length of stay for the MIS group was 2.1 days, compared to 4.8 days for the traditional repair group. That gave them a p-value of 0.01, which is statistically significant.
Reducing the hospital stay by more than half is huge. It suggests that MIS not only achieves the same clinical success, but allows for a much faster return to baseline for the patient. In the context of spontaneous intracranial hypotension, where these patients are often quite debilitated by their symptoms, getting them home and moving in 2 days instead of nearly 5 is a major win.
And the study concludes exactly that. While both techniques are effective, the MIS approach offers the distinct advantage of shorter recovery and hospitalization. It really supports the idea that we can reduce perioperative morbidity without compromising the outcome.
It's a clear message for the neurosurgical community. As we refine our MIS techniques, whether through tubular retractors or endoscopic assistance, we aren't just doing it for the cool factor. We are providing a comparable repair with a significantly more efficient recovery profile.
It definitely sets a new benchmark for how we should be evaluating these cases moving forward.
Well, that's all the time we have for today's episode. A big thank you to our listeners. This meta-analysis from World Neurosurgery 2026 provides the high-level evidence we've been looking for in spinal CSF leak repair.
Thanks for joining us. We'll see you next time on the Neurosurgery Hub podcast.